All right, now we're in day 2. So day 2 comes in. This is where we're going to close them as a cash patient. We're going to help them with their health. So they walk in, same deal. They're greeted by staff. Boom. Toma un asiento, por favor. Take a seat, please. The doctor will be right with you. El doctor va a estar contigo. And then we're chilling in our cave, in our office here. Or maybe I'm with patients. I might glance at them, say, hey, ¿cómo estás? And then if we need to wait, I sometimes will have the staff put them on like a little complementary therapy. If not, they'll just pop a squat, and then I'll just pick them up right away. So we'll do that right now. So I'll walk out. Hola, muy buenas tardes. Pase adelante conmigo, estoy listo para ti. Right? Very serious, right? Whereas on the first day, I might be like, hola, muy buenas, or, Eustoquio, okay, mi nombre es Dr. Castillo, mucho gusto, pase adelante, right? That's day 1. Day 2, hola, muy buenas, estoy listo para ti, pase adelante, por favor. Right? Very, very serious, because we're going to go over x-rays, right? So we're going over the x-rays. We got our x-ray machine, and then we got some examples of, spinal decay. It's always good to just have a little benchmark. I'm not going to pull up x-rays, but you get the picture. We pull up the x-ray. A lot of times they'll have, remember, somebody to translate, so it's not like you're under a lot of pressure, but try, right? Try. Let's say you know where the cause of the problem is, and you want to point to it. Maybe you put some markers on there saying, aquí es la causa del problema. Yo encontré la causa del problema. I found the cause of the problem. And sometimes I'll say like, esa fue una idea buena. This was a great idea porque pacientes que tienen este tipo de dolor, es evidente que hay un problema con las radiografías también, right? Patients that have pain like this, we can find it in the x-rays. And then I'll actually point to it like easy ones, guys. Caderas, las caderas, which are hips. Hips, I'll ask them, ¿cuál es la diferencia entre tus caderas? And then I'll point to each cadera. And I'll actually write lines so that they can know like, oh, this one's higher than the other one. Yep, esta cadera está chueca. That hip is crooked. It's a very harsh word. Chueca, crooked. If there's any curvatures, chueca, I'll actually write that on the x-ray. There's a little blank that you can type words in, and I'll write chueca aquí, so that the patient can tell me like, oh yeah, it's chueca, right? And then my favorite ones are the side views, because then we can look at our handy-dandy chart and be like, ¿cuál es la diferencia entre este y este? And then they'll tell me, and it'll be super obvious, like loss of curve, weird spurs and degeneration. Sometimes we'll find some spurs up there in the head too. Some other types of conditions. I had somebody come with like blocked vertebrae too as well, like semi-fused vertebrae. That was an interesting one. That's where all the neck pain was coming from. I was literally pointing to a guy right in here, and I was like, what's the difference between that one and that one? He's like, there's no space in between the bone. I'm like, yep, that's what's causing your neck pain. So just keep it quick, short, sweet, to the point. Have stuff already pre-written on there so that they can easily find out what's going on with them, and you ask them what's wrong with them so that they can tell you what's wrong with them, versus you just like blabbing about it. Like you want them to tell them. You want them to tell you what's going on based on what they see. After that, shut it off. Boom, we're going to the review of findings. So I do yeah, that works. I got one right here. I do a 4-page spreadsheet. Not spreadsheet. Well, it is a 4-page booklet. Looks kind of like this. It's got my emblem on it. This is what all the Premier Healths in our area have done. We have a chart with what their x-ray review was. I'll walk them through what muscles might be affected. All right, they always want, they want the whole shebang. So we'll talk about their muscles that might be affected. We'll talk about the bones and the areas that we adjust. So I'll circle each area that we focus on. All right, if it's low back, I'll still circle low back. We'll adjust the mid back and the neck, make sure everything is aligned. Patients that get full adjustments get better results. Sometimes if they got like the radiculopathy, I might talk to them about like, oh, this is what's causing your radiculopathy, right? Esta cuerda, ese tendón, right? I'll literally call this a tendon. This right here, I'll call it a tendon. Even though we know it's not a tendon, but what do they think it is? They think it's a tendon. So I call it a tendon. Judge me. So anyways, we might talk about, let's say it's a headache, right? I'll talk about nerves in the neck, and I say, el nervio está pinchado. The nerve is pinched. Total Spanglish slang term, but patients have used that on me all day. So I'm going to use it right back. Está pinchado. Oh, I wish somebody would have told me that before. There's no way a medical doctor would ever say that. They say like, there's probably like some sort of compression on the nerve. It's like, no. The nerve is pinched, right? And it's slang, pinchado, right? Yeah, so I use slang words because that connects better with patients. Next, talk about how health of the nervous system is directly connected to organs. I like to try to connect it with areas of discomfort that they're having. So if it's low back pain, I might say, hey, sometimes patients have problems with digestion, but the good news is that once you start taking pressure off the nerves function better, organ systems function better too. Helps your lungs function better, your heart, your sinuses, helps things with like eye conditions like dizziness. I'll say to them, oh my gosh, I have dizziness too. Like, I wish somebody would have told me that, right? And I'll say it, I'll preface it like, hey, we understand, most people understand. We get it that you guys understand we fix neck and back pain, but that's not all we can help you with. And I don't necessarily say like we cure it, but I say we can help with these conditions or help alleviate these types of conditions. Then I'll circle the main symptoms. This is just a symptom chart, and so I'll circle the symptoms that they're experiencing and the connections to the chart. And then I'll kind of, as an aside, if you know anyone that experiences pain in like the low back, if they don't have pain in the low back, or numbness and tingling down an arm, and let's say, I'll say, hey, if you know anyone that needs help with those types of conditions, we can help. And then last but not least, I'll walk them through iceberg. So if you guys need this stuff, guys, it's so easy. Like, you can order online. I can give you my order number. It's pretty easy. So then you have the iceberg chart. I write dolor, which means pain in Spanish. I write 100% down below. And I kind of walk them through the two different types of paths that you can use in our clinic. You can either just try to fix it, maybe with a couple adjustments, and then I write a little cycle. Es un ciclo del dolor. Con este camino, with this path, it's just going to be a cycle of pain. That's on you. However, for this type of condition, I would recommend, and I might even preface it like, yeah, some patients that come in, we have car accidents and work accidents, we're seeing it for like 6 months to a year. 6 meses a un año. 30, 40, 50 tratamientos. Muchos tratamientos porque hay muchos daños. Con tu condición, vamos a recomendar 24 or 20 or 30. 20 tratamientos, we'll say. Comenzando con 2 citas cada semana or 3 citas cada semana, 3 times, starting with 3 times per week. Poco a poco vamos a reexaminar para reducir las terapias, documentar cosas que están mejorando, to document things that are improving, and continue on and on and on to stabilize the spine. And once you get to here, cuando está 100% de salud, vamos a recomendar mantenimiento de vez en cuando para prevenir dolor regresando. ¿Me entiendes? Right? I love using that word. ¿Me entiendes? Do you understand me? Because it gets them to say yes. Yes, yes, yes. That's what you want during a day 2. So we just went over that 3 times per week. Sometimes we'll go consistent, or sometimes I'll reduce frequency. That just depends on multiple factors. But I like to preface it with saying, hey, once we get to 100%, we're gonna show you maintenance options so that you don't have to do all this over again, is basically what I'm saying. And they get it. So, and I'll say, ¿me entiendes? They'll say yes. Perfecto. If they brought in insurance, I'll show them the insurance benefits and tell them what their insurance benefits are. If they don't have insurance, I'll still walk them through the same cash plan, but I'll still explain to them that With insurance, this would be the total cost of your treatment plan, but because you don't have insurance, you're gonna get a discount, all right? So without further ado, I'm not gonna go on a cash plan specifically, but that is what I give to patients. So I'll give them a sheet. It's gonna show them how many treatments, the frequency, what's included. Excuse me, I'm about to sneeze here, but I'm on a roll. And then if they have insurance, great. If not, it's gonna go, here's the total cost normally with health insurance. Since we're not paying with health insurance, this is gonna be your discount. And then it'll be a sum total. You can either pay in option 1, which is a 10% discount, or option 2, 4 monthly payments billed on the first of the month or the 15th month. Which one works better for you, right? I would add though, out of all this stuff at the beginning, you wanna make sure that they understand that you remember the first day. So before you actually start your day one, make sure you start a little bit with like, hey, remember when we talked about your low back pain affecting your job or whatever, or like it's affecting your walking, stuff like that. Have that in the back of your mind so you're able to regurgitate that on your day 2 so they know that you're not just like a robot. Make sure that you know that why they're there, how your care specifically focuses on this aspect of their life, and how you're the solution to that. That way, that will help too as well. I should have said that, but I'm on a roll here. So after that, let's say they say pick option 1, they pay in full. I'll say felicidades, which is like congratulations. Estos tratamientos van a ayudarte mucho, muchísimos. Por hoy y el futuro también. It's going to help you a ton right now and in the future. This is my personal touch. Tenemos otros casos aquí en la clínica. Hablamos español. We speak Spanish. Cuidamos a accidentes de carros y trabajos. La razón yo digo es porque estamos adentro las aseguranzas del estado. The reason that I say this is because we are within the insurances here in Minnesota. All right, I just keep it real short like that. But we all know that it's because we've decided to take on the administrative task of processing all of your bills through a car insurance company or a workers' comp, which ends up being a lot of administrative work. But we have staff to do it, and we understand that, and we actually specialize in it. So I make sure to share that with them. Not that second part, but between us, it's a lot more work versus just cash. It's just cash money, boom, 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 boom. They're in and out. So once they start with that, sometimes they'll even ask weird questions like, so what are we doing today? Or is that just the therapy and the adjustment? Okay, so vamos a incluir un ajuste y terapia cada día. Or cada visita. Sometimes they'll say cita or visita, which means appointment. So that's our process. Maybe you don't do therapies. Maybe it's just adjustment only, which is fine. You could just say, cada cita vas a recibir un ajuste. Vas a recibir un ajuste y poco a poco vas a mejorar. Little by little, you'll get better and better. So that's it. Day 2, quick and simple. If you want me to modify that for maybe your specific flow, I'm more than happy to. But I use a pretty straightforward process. I like to review what the x-rays were, how we work with muscles, bones, how you can either just kind of use this for patch-up care but not really fix anything, but you can also do our recommendation and have a better chance of getting to 100% and fix the problem for good and then work on maintenance afterwards. So pretty easy spiel. I learned it from another doc. But reach out to me personally via email and I can definitely whip something up for you if that's your liking. So that's what I got.